And basically what I saw was certificates issued by the government that said 20 years. So they were issued in February 2020 and they expire in February 2040. And so this whistleblower was basically just really concerned because they'd never seen this before, and they didn't really understand why a person who has crossed into Canada illegally, someone who's not even deemed a refugee yet, they haven't even had their case heard, why they are being given healthcare coverage above and beyond what Canadians receive. Not just Canadians, better healthcare than veterans, better healthcare than people in Indigenous communities, better healthcare than the elderly, than homeless people, than single mothers, better than anybody. Why are they given this? One of the examples of the documents that I saw was issued to an Iranian woman who was in her 70s, and she had just arrived in Canada, just made her refugee claim, and again, she was given a 20-year certificate. So presumably, for the rest of her life, she's going to be able to receive that gold-plated healthcare in Canada that Canadians are not entitled to. So on the certificate, on the document, it says the above named individual is eligible for coverage of healthcare costs under the interim federal health program. This coverage can be canceled without notice if the individual's immigration status changes. So according to the form, it kind of says, well, this is what they get until the status changes and then this gets taken away. But in practice, we know the interim federal health program has become a political punching bag in Canadian politics over the last few years. The previous Harper Conservative government, so before Trudeau was Harper, and he made changes to the interim federal health program. He basically tried to limit it so that people whose asylum claims were rejected, or people who arrived and made asylum claims in Canada but were from like safe European countries or just safe countries, the United States, Western Europe, they didn't get access to this. So this was only reserved for true refugees. Well, the media and the Trudeau Liberals spun that to make it say that the Harper government was trying to cut healthcare for refugees, even though the people they were cutting were explicitly not refugees. A federal court ruled in favor of that sort of left-wing perspective, the liberal point of view, and a federal judge said that it was cruel and unusual, that's a quote, cruel and unusual for the government to withhold this free healthcare to illegal immigrants. So they scrapped the program, and then when the Trudeau Liberals came in, they made all kinds of changes to the refugee determination program to make it a lot more generous, a lot easier for refugees to come and make claims and get the free health care. So, you know, even though the form says that the interim federal health program can be taken away if the person's immigration status changes, we know that in practice the Trudeau government will not take it away because they accused the Harper government of being cruel for taking this away. So basically, what's supposed to be a temporary program, what's supposed to be a limited program, is the opposite. 20 years is not temporary, and the whole idea that it's limited is not true because it literally includes all the kind of healthcare, including things that Canadians are not eligible. So I think it's a big story. I reached out to the government and basically asked, like, what's going on? Is this new? When did this come about? And I received several responses from them saying, look, we're working on this. We're going to get you an answer. We're going to figure something out. And then they just never got back to me. They never gave me a response. They never gave me an explanation about this. I think Canadians deserve an explanation, because why is it that a person who might not even have a real claim to be a refugee, just because someone says they're a refugee, they actually have to prove it? That the whole point of our system is that you have to provide evidence and prove to an immigration judge that you are in fact a refugee, that you do face a well-founded fear of persecution. And the people who are being given the healthcare, the gold-plated 20-year access healthcare cards, haven't proven that yet. So why is it that foreign nationals, people who are not permanent residents, not citizens, are getting a lot better healthcare than people who pay into the system? I think it's a big, big story, and I wish that the mainstream media would pay attention to these kind of things, because I think that Canadians really, really care about them.